Hello everyone, this is Dr.Shyam. I welcome you all to my channel Dr. Pharma. And on this video, I'll be discussing on an infection that is mucomycosis, which is seen in a COVID-19 patient in India recently. And a number of cases has been reported in Gujarat and then Mumbai, Delhi and several other states. So we'll see what is this infection. Now, the mucomycosis is also known as black fungus, or you can say it is a fungal infection or disease which is caused by a group of molds called Mucomycetes. Now, before this disease was also known as zygomycosis. Zygomycosis. Now, this fungus can be found in soil and then leaves, decayed woods and also in putrefied manure. This fungus can enter into the sinus and it can deposit there and infect into the sinus, and apart from this it can travel to the brain also, causing the infection to the brain. Now in India, this infection by the fungus is increasing rapidly to the vulnerable patient with those with COVID patient. Now according to the professor, that is Peter Collignon, which is an expert committee of World Health Organization on the antibiotic resistance and infectious disease, said that this infection has high mortality rate. This has a high mortality rate and it is so difficult to treat this infection because a patient may require a larger number of drugs as well as the patient may need a surgery. That is why it's difficult to treat this disease or a patient having this disease. Moving to the risk factor, if you see the risk factor of this disease, the people with diabetic condition is at more risk to get this infection, and then the patient who is on medications like steroids, then who is treated in ICU for prolonged interval of time, is also at high risk to get this infection, and those patients having decreased immune system, or you can say weak immune system, that may be because of previous organ transplant surgery, or you can say the cancer therapy. So these are some of the risk factor of the infection. Now the next question is, why is it appearing now in COVID patient in India? See, this infection has been seen throughout the world, including US and Australia, but at present the more infection is seen in COVID patient in India. The reasons are because the virus is attacking our immune system, decreasing the immunity. That is why this infection will get a more chance to infect the COVID patient because of decreased immunity. And then second thing is, high dose of steroid is given to COVID patient. You know, the COVID patient has been treated with the high dose of steroid. Why? Because the steroid will decrease the inflammation. But see, at the same time, the steroids will also suppress our immunity. Suppress the immunity. So unfortunately, the steroids also suppress the immunity, decreasing the or it will makes our immune system weak. That is why again this infection due to, or you can say fungal infection due to decrease in immunity, they can attack to this COVID patient, causing a infection, or we can say causing a disease. Then next is, you know that in India the health system is at high pressure because of this pandemic, because of a large number of cases increasing day by day. So you can say due to the crowded and cramped environment, is giving more chance to spread this infection. So these are some of the reasons, you can say, why the COVID-19 patient or the individual who is suffering from COVID infection is getting this fungal infection, that is mucomycosis, or you can black fungus. So ultimately you can say that due to decrease in immunity, because COVID-19 patient is having a weak immunity because of this virus, because of the steroids. That is why this fungus is attacking on this patient, leading to infection. Now talking about the signs and symptoms, the patient will have pain and redness around the eyes and the nose, and then they may have fever, headache, coughing, vomiting with blood. So that is why. And there will be a black and the bloody nasal discharge. That is why it is also known as black fungus, because there will be a black discharge from the black color discharge from the nose, and there will be a pain in one side of the face and sinus. Again, there will be a blackish discoloration over the nose. There may be a tooth pain, or you can say there may be a painful and blurred, or the vision may be blurred. And then fluid and tissue samples may be taken for diagnosis. Now if you talk about the treatment, the antifungal drugs, most commonly nowadays amphotericin B is used by the medical professionals to treat this infection, and there may be a need for surgery to clear out the source of the fungus. Now talking about the prevention, the Indian Council of Medical Research as well as the Union Health Ministry has urged the people to wear the shoes and then long trousers, long sleeve short, and gloves while handling the soil, moss, or you can say the manure. And then the person should maintain the personal hygiene. And then you can say as you know, the diabetic patients are more prone to get this infection, fungal infection. Their diabetes that must be in a control level by taking an anti-diabetic drug. And the ICMR, that is Indian Council of Medical Research, has also urged the medical professionals to discontinue the immunosuppressive drugs. As you know that in COVID patient, the steroid is given to decrease the inflammation, but unfortunately the steroid is also decreasing the immune system of that patient. That is why the steroid should be discontinued, or it should be given in low dose, or when the patient is able, immediately it should be removed or discontinued. So these are some of the information of mucomycosis, or you can say the fungal infection. I hope you like the video. Please share the video so all of us can get the information, and it is a very important information regarding fungal infection, because you know that nowadays most of the COVID patient is getting this infection. So by this preventive measures we can prevent this disease. Thank you all.